Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Good morning and welcome to the Executive Innovation Show's Knowledge Knugget edition. Today we're going to be talking about telehealth and nephrology, brought to you by One Touch Telehealth. We've seen a huge rise in nephrologists and pretty much everyone associated in renal care moving to telehealth during COVID, and it still continued post-COVID. So we wanted to share today 7 to 8 main areas in which we've seen telehealth being used successfully in renal care. And so the first one is you have a very vulnerable population that still has to go to dialysis for the most part 3 times a week, and keeping nephrologists safe, keeping their the dialysis patients' exposure limited. Of who's coming in and out of the unit. The first one is really seeing the patients in unit. So nephrologists know their patient's schedule and when they're going to be in unit, and really being able to do telehealth while they're sitting there for 4 hours in their chair and having their monthly visits with them while they're in the unit. This is a great way to utilize that time and allow the nephrologist to really reach out and have more proactive care for the renal patients. The next one is we've seen dietitians for new renal patients, new dialysis patients, dietitians really mobilizing for home dialysis patients, patients that are in facilities, talking to caregivers and talking to patients about a renal diet, going over that and virtualizing that. In addition, you typically have your dietitians that service multiple dialysis centers, and this has allowed them to stay in one location and or work from home and hit patients across multiple units. The next one is really the pre-Esrd kidney education. So as we look at the rising number of patients that are going to have kidney disease, having those initial consults with a nephrologist, seeing if there's ways to really change the numbers and educate them, and even we're seeing more people getting started on dialysis, obviously earlier in stage 3 or stage 4, but really providing that education and being able to do that virtually has been really important too, as that population is maybe not as vulnerable as folks that have stage 4 and stage 5 in stage renal disease, but allowing to have that education. Medication refills. So dialysis patients are, typically on lots of medication given it's chronic care, and that might not be the only chronic condition that they have. So medication refills, office visits, follow-ups, things like that, all can be done via telehealth to, again, keep the patient safe and keep your nephrologist safe as well. The next one we saw a lot of, which was really the nephrologists that have patients in nursing home, in skilled facilities, that might also be in a rehab facility or some type of facility that is limiting visitors coming in, limiting doctors coming in. So still being able to see those patients. It could be the video telehealth. It could be a nurse connecting for that patient. It could be the CNA. It could be a caregiver, but really allowing those patients to stay in the facility. A lot of them are still isolated, and seeing those patients. The next one is, as more and more patients are moving to home dialysis, these patients aren't in the dialysis center, but still need to see their nephrologist. And so seeing those patients in the home, being able to provide that proactive care and still allowing them to stay at home, to stay isolated, to stay social distancing, but still get that care while they're doing it home and while they're home dialysis. And that leads to the next one is those home dialysis patients still might have issues with their Baxter machine or cycling, or they might need supplies. They might need tech support with the machine. Maybe something's going on and it's super critical. Being able to do that via video chat / video telehealth is not your typical telehealth appointment, but moving that to video, as you don't want to send people into the home from that perspective, has also been really critical in providing that immediate care, being able to see what the patient's seeing without having to send somebody into the home from that perspective. So as we look at telehealth and nephrology, I think it's just the tip of the iceberg. I think nephrology will see a hybrid model to be able to provide more proactive care to renal patients, to provide telehealth as a hybrid in seeing patients in the unit, seeing patients in facilities, things of that nature, that maybe nephrologists were kind of pushed into telehealth overnight, but have now really seen the benefits. We've seen comments soaring from patients of how convenient it is. When you're talking about a renal patient that's going to dialysis 3 times a week and still having to do see other doctors and things like that, convenience is definitely critical in this patient population. So I think it's just the tip of the iceberg, as we've seen the bill that Trump passed about home dialysis in 2025. I think this was a much needed push for the industry, since that's where it was headed, and getting them educated more now. So as always, this is the Knowledge Nugget Weekly Edition. Feel free to subscribe to your podcast player of choice, or subscribe on the video portion, and stay tuned for the Knowledge Nugget next week. This wraps up the telehealth and nephrology and tips and best practices that we've seen during COVID. Thanks for joining this week, and we will see you next week.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.